Over the past 2 decades, there's been a surge in the use of Class A drugs such as heroin, cocaine, methamphetamine, and synthetic drugs in Eastern and Southern Africa. The ESACD blames it on the expansion of organized crime networks across Africa. At the launch of the organization's flagship report and action plan in Kenya's capital, Nairobi, delegates were told the region has become a major transit and destination corridor for drugs.
These drugs are moving from countries on the northern part of the country, across Kenya, as has been said, through Tanzania, all the way to the southern part of Africa and across the Indian Ocean.
The ESACD says the drug trade has evolved and become more sophisticated, requiring a change in strategy.
Many countries in the region lack comprehensive evidence-based drug policies with which to counter the problem productively and effectively, often with punitive measures prioritized over harm reduction and rehabilitation.
Countries in the region have been urged to come up with an aligned policy framework and provide more support for drug users. The European Union, one of the Commission's partners, says the approach has been effective in its jurisdiction.
Our EU drug strategy and action plan reflect this evolution, emphasizing harm reduction, treatment, prevention, and targeted law enforcement that focuses on high-level criminals rather than on criminalizing people who use drugs.
The ESACD warns that if urgent action isn't taken, by 2050 an additional 14 million people will be using drugs in sub-Saharan Africa. According to the report, traditional methods of fighting the drug trade in Eastern and Southern Africa have largely failed. The recommendations focus on new strategies such as scientific-based evidence, people's health, and respect for human rights. CGTN, Nairobi, Kenya.